Here we're looking at the radius. Now the radius is one of the two bones of your forearm. What we can see here is this portion up top, this is the proximal portion of the bone. That is the round head of the radius. Now we'll zoom into that in a second to give a better view of the proximal end, and the same thing for the distal end. But want to give this perspective of the anterior portion of the radius. Now let's focus on this proximal end for a second. Now that we can focus on the proximal end, you'll see this round head of the radius here. This nice round head of the radius is a good indicator of what bone it is. Just below the head, right here, is going to be the neck. And just below the neck, this rough patch right here is the radial tuberosity. So now kind of turn it around a little bit and shift it. You notice it kind of gets a little rough, has a little outcropping there. That's the radial tuberosity. Now we need to switch perspectives down to the distal end of the bone. Now that we're down at the distal end of the bone, we can look at this little indent right here. So if I rotate a little bit, you see there's this indent. That indent right there is going to be your ulnar notch, the ulnar notch. Now this is the anterior view. As we move it around, you can kind of see it's a flat, almost scoop-like feel here. Where the posterior side, you can see has more of an outcropping here. So this is the anterior flat scoop. Right here, so we rotate around, that is going to be your ulnar notch. Now we know the ulnar notch right here is going to articulate with the ulna. So ulnar notch articulates the ulna. And the other landmark down here, this point is the styloid process. That point is the styloid process. Now let's go back to the full view and reorientate. Now that we're back to the full view, just kind of run through those real quickly again. We have the head on the proximal end, the head's up top. With the neck, we have the radial tuberosity. We have the ulnar notch down here. And then we have this little point. That point is the styloid process. So we need to make sure we can orientate the radius. Is it a right or a left radius? The radius is going to be sitting on the lateral side of your forearm when you're in anatomical position. So it's basically on your thumb side. The ulnar notch down here, this ulnar notch, has to articulate with the ulna, which means it has to face medial. And we already mentioned that this flat portion here is anterior. That means this bone is a right radius. Right radius because the head is proximal, that's in the elbow. Flat part anterior, ulnar notch has to face medial. Right radius. So that is your radius.